I am Dr. Sal Pascarello, Superintendent of Schools for the Danbury School System, and welcome back to the 09-10 school year. As you know, last year we began a series of information sessions talking about the excellence in the school system. We'd like to start this year out with a panel and a discussion about the H1N1 virus, which we'll be dealing with this fall. And we thought as a public information series, this may be the first in one to inform parents and teachers about the activities that the district has been working on in conjunction with the city and the plans we have to begin the school year in September. We're lucky to have with us, I think, a group of individuals who have been working together from the city and his town, as I mentioned. And Dr. Draper is our medical advisor of public health. Dr. Draper is a retired pediatrician, long-term resident of Danbury, and has been serving in that capacity for a while and advising us. We have Scott Leroy, Director of Health Department for the City of Danbury. We have Melanie Bonjour, Health Department Coordinator of Activities, who really works with Sula Vassar, our nursing supervisor, in dealing with the clinics that we have in our buildings. And then we have Sula Vassar, who's our Coordinator of Health Services for the Danbury Public Schools. And with that, Doctor, let me start with you.
Sure.
I read today, actually, that schools heed flu warning, that Washington, hundreds of schools are heeding the government call to set up flu shot clinics this fall, preparing for what could be the most widespread school and vaccination since the days of polio. And maybe you can give us a little background and what's referred to now as novel H1N1,
Sure.
and a response to sort of what we're getting from Washington regarding what we're going to be
Sure.
faced with. Thank
Well,
you.
I think nearly everybody has heard a lot about H1N1, which we now call novel flu, and which some have called swine flu. They're all the same particular virus. And what's interesting and important about it is that it's a new virus to the community, and so there is not a basic immunity on the part of people. And this has had important effects bearing on the school population, in that young people, historically, in our experiences in the spring when the H1N1 first appeared, the young population is being affected to a larger degree than the older population. In the usual seasonal flu, we tend to emphasize the older population in terms of immunization. But this new virus is having its major impact on young people, both children and young adults. And so they become an important target of an immunization program that we're embarking on.
Well, what are the symptoms of this new virus?
The symptoms are, as with traditional flu, fever, cough, sore throat is the major symptom, and it varies in intensity from one person to another. Some can have it quite mildly, and others are sick to the point where they need to be in bed.
So the profile is very similar to the flu itself.
Thus far, it appears to be very similar to the usual seasonal flu.
And you had mentioned something in one of our conversations, and Scott, I'd like you to respond to it as well, because we keep hearing the word pandemic. We need to talk about that. But you had mentioned that they're modeling something that's happening in Australia regarding the impact it may have on North America.
Right. Right now, this is the winter season in Australia, and the experience with this virus, which is very prevalent there at the present time, is being watched by our epidemiologists to follow its severity. And what it's telling us is a number of things. One is, and most importantly, is that there are two viruses active at the same time. And while the predominant one in Australia, about 80% of the cases of the novel flu, H1N1, there's still about 20 or 25% of cases of seasonal flu. So we're likely to experience that as well, so that we're likely to have two infections. And because we're likely to have two infections, we have two immunization programs planned. And we're going to put a major emphasis early on seasonal flu vaccine, and that's going to be starting early in the school system. And then when the later in October, when the novel flu vaccine becomes available, we'll be embarking on vaccination for the population at that time.
All right, I'd like to talk more about that, but what's the pandemic part of it? Would
Yeah,
you
well-
talk about that?
Yeah, well, the short version is that the World Health Organization issued a stage 6, meaning it's worldwide pandemic, has to do with the amount of cases found in each country, not the severity of illness, which is a lot like just say seasonal flu, but it's found commonly throughout many countries. And even during the summer months in the United States, we've been finding regular flu being found, which is not normal. So we're being prepared and following the Australia model to expect it to come and also be prepared as well.
So in the fall, we're going to vaccinate and just observe the regular flu so we can discern it from the novel flu. Is that sort of what we might expect this fall? Is that how that would work?
Well, in part, what we're trying to do is to immunize as much of the population against seasonal flu,
That's correct.
so that hopefully that population could be distinguished if they develop flu symptoms as more likely to have H1, have the novel flu as their illness.
So given that information, Scott, and I know you work constantly with the state in terms of their evaluations, and Jody Rowe came out with something today as well, I understand on the news. Do you see us, last spring we were thinking about closing school. The mindset here is different in terms of protecting our faculty and our students, correct?
Yeah, the mindset.
Talk about that.
Well, the knowledge of the H1N1 strain is now evolving, and the idea is that it's no more of a case of illness than seasonal flu, but you do want to prevent the spread, so you want to try and get people to be vaccinated as much as possible for the seasonal flu, and then there'll be a separate 2-series shot for H1N1 flu. And that combined with the educational efforts to stop the spread, and also educating people that if they feel ill to stay home, they could recover within 24 hours hopefully, and then therefore you then could prevent any widespread closure of not just a school but other grouping type of pattern.
The information that I've been looking at, there's been some real caution about vaccinations. There are a lot of new parents and for infants that because of the thalidomide, the preservative, what is the
The Marisol.
The Marisol.
Yeah.
That may cause problem. Would you talk a little bit about the safety of the vaccine and
Yes, the
the Marisol?
Well, the
Yes.
field trials are going on right now, but the composition of the vaccine is such that it's not going to have any of those adjuvants with it. It will not have thimerosal particularly as part of the vaccine, so it'll be a straight vaccine. And so the people are concerned about the adjuvants, as I say, thimerosal being one of them, will have no concern of it, have no reason to be concerned about that, because it will not be part of the new vaccine.
Yeah, it's the same as the regular flu shot, it's just a different strain. So it's just the flu shot, just a different strain being vaccinated.
I know you've been a pediatrician for how long?
Well, quite a few years.
So I mean, the advice you can give the parents and families about this is that you feel confident that it's a safe
The vaccine?
vaccine.
We do think it's not only is it safe, but I think it's very, very important for young children this year to receive both vaccines.
And Sue, given that information, what have we done as a school system this summer, working with and planning for the opening, and any policies that we'll be implementing and notifications? Can you talk a little bit about that?
Sure. We've worked all summer as a group and individually to develop plans that would address varying severities of the pandemic if it hits us and how hard it hits us. Initially, we're starting off the school year with the focus on prevention, really preventing the spread, which is really will help us immensely. We've ordered a lot of additional soap dispensers. They'll be placed strategically throughout the schools. We're going to give kids ample time to wash their hands throughout the day. We have laminated posters that will be up all through the school to remind kids to do this. The nursing staff will be going around to classrooms to show kids proper techniques. We do this anyway. Generally, we start it before flu season in October, November. We're going to be kicking off the year with this. We have also developed a surveillance tool, which will be important as we look at this and how it is affecting our staff and our kids, where we will be tracking absenteeism rates on a daily basis, looking for any peaks, and absenteeism, really monitoring the children that come into the health office and the symptoms that they have. And we'll be working very closely with the health department to report this to the health department so that we can keep an eye on just how widespread this is in our school. We're also, we'll be offering a flu clinic, again with the focus on all children getting the flu vaccine. We don't know yet when the H1N1 vaccination will be out, but for seasonal flu, we're going to do that on September 26th. Parents will be receiving a lot more information about that. It's a wonderful collaboration with the Danbury VNA. There will be some help for families that don't have insurance, and we want to encourage all parents and get all of our kids vaccinated.
Do you have a date? Can you restate that for the
Yes,
audience?
it's a Saturday, September 26th.
What time?
We don't have the time set, but it will go all day, probably starting by 8 in the morning and go all day.
And where would that take place?
We're going to do that in one of our schools, probably either Broadview or Rogers Park at this point. So we're looking at what's easiest for parents to come in to facilitate that in large numbers.
Yeah, and
Yes.
if I may, part of the information there is, I believe to date, the federal government is going to push out the supplies and the vaccine for free to the vaccinators, so people don't have to worry about the cost of the shot for the H1N1 shot.
Now, how does that relate to the governor's message that I just picked up little snippets of it? Did you have time to read the press release?
Well, I get so many.
Okay. Well, I think we need to talk. They talked about who would be in position to receive them.
Of the high risk.
The high risk. Has there been any change? What is the high risk population for inoculations, Doctor?
Well, the high risk, pregnant women are high on the list, healthcare workers and young children. The age group 6 months to 24 years is important. And of course, people who have complicating events in their basic immunity. People have immune deficiencies, diabetes, asthma. Those folks are at higher risk of the complications of flu. So they are high risk, and therefore they will be eligible for the vaccine at the earliest time.
And, Melanie, for families, what advice can you give from your perspective?
Well, there are a number of everyday measures that families, individuals can take to reduce their exposure to influenza. Proper hand washing is important, covering their cough or their sneeze, preferably using their elbow, but if they do use their hands, try to get a tissue if it's available. If they do use their hands, obviously washing their hands and using a hand sanitizer, and to dispose of any tissues in the trash can. Remaining at home if they're sick, if the children are sick, if an individual is sick, and if they should suspect that they have a flu-like symptom with the temperature, fever, that they remain at home. The CDC recommends that they remain at home 24 hours after the temperature has subsided. Stay away from individuals who might have flu-like symptoms, so that means distancing from them, staying home. And it's very important to keep your children home from school if they are sick. That's one of the best ways to prevent, the transmission. And I think that we often overlook the importance of adequate rest. Children, adults in general, we don't get as many hours rest that we should, so at least 8 hours of sleep on a daily basis, and proper nutrition. Good breakfast in the morning, lunch, decent lunch, adequate dinner, and just everyday, healthy practices. And I think those are probably the best steps. And as Dr. Draper had alluded to, and Sue had mentioned, all of us had mentioned the importance of getting the influenza and the H1N1 vaccine.
We're going to have a protocol to observe the data regularly. And as last year, I want to commend publicly Scott and Sue. The communication was phenomenal between you two last year. We're really proud as a town to have that kind of coordination. But if in fact there's been some confusing information, if we observe that we have a high percentage out and we ask for individuals to remain home, we still may not close school. There has been an idea, at least in the literature, about cleansing, and what I'm reading is that there isn't a relationship between cleansing a facility and getting rid of the virus. Can you speak to that, sanitizing a school or an area or a classroom, if in fact we think there's H1N1, or what's the literature?
I think your general cleansing is applicable to this. It doesn't have to be changed because of H1N1. because the virus basically won't exist 12 hours after it's on an inert surface. So if you close up a room or something and there's nobody in there for 12, 18 hours, the virus disappears. So it isn't cleansing that gets rid of the virus.
Okay, understood. So that's our MO. I know, why don't you talk a little bit, you've worked with Mr. Rodriguez, our maintenance director. What are some things that we have done? Have we done anything?
Well, we
I
have
think in this-
communications back and forth whenever we get anything from cleaning from the state. Certainly, we've gone all green, so that's one thing that we've worked hard on in the school district. And I have just talked to Mr. Rodriguez about the emphasis of cleaning common areas, and even during the school day. We have janitors in the school during the school day to, the doorknobs, and if we can, the desktops, and those areas where it's just common areas to all the kids. So I think will be a lot of our focus.
As a school system, are we going to reach out to the high-risk population, teachers, and
Yes, that is certainly a part of the plans that we put in place. It's going to be very important that as we see incidents in the school, which we pretty much expect, that our high-risk population, our children who are medically fragile or have chronic illness, any of our teachers with that, will be notified and really kept abreast very frequently that this is in the school, encouraged to seek out their private providers for advice specifically to them and coming to school and how they can best protect themselves.
anything to add for the public that from your perspective is a good time to do it?
From the city's perspective, as the health department, we partnered with the state. We received increased funds in response to the H1N1 flu virus, and we're partnering with the Danbury Visiting Nurse Association and the hospital to ensure that there's adequate storage and supply of the vaccine on hand.
And we have adequate.
Well, the CDC has a plan of rolling it out. It depends on the manufacturer. There might be vaccine, and should be vaccine by the time your scheduled clinic runs. But again, that's a future tense, and we'll see if it's there.
So Sue, from what I've read, I mean, our nurses are certified to inoculate. Is that correct?
Absolutely, and they will be definitely a part of that plan, because we'll need the labor force to vaccinate at this widespread.
Yeah, and I'd like to add to that is that if a student or a parent cannot make this clinic, I believe that our school-based health centers can also provide that vaccination for children who are approved to attend, correct?
Do you want to talk a little bit about the health-based centers, where they are and how it would work?
Sure. We have 3 school-based health centers in the city of Danbury. 2 are at the middle schools, at Rogers Park Middle School in Broadview, and the 3rd at Danbury High School. They're outpatient clinics, just like a pediatrician's office, that provide medical care to the students that are enrolled in that school and who have parental permission to use those health centers. Our school-based health center staff have been and will continue to work with the school system and the school nursing staff to monitor and do some surveillance on seasonal flu and the H1N1, and will be prepared to be able to assist with the vaccination. The 3 clinics are part of a statewide, a school-based initiative to, again, do the monitoring, surveillance, and to assist. And if there are children that are enrolled in the schools and miss the Saturday clinic, that they certainly can take advantage of what the health centers can offer, and we encourage that.
What about the adults?
Well, if I can add to that,
Yes.
if parents are comfortable with their existing healthcare provider, it's okay for them to ask their healthcare provider to sign up with the state to be a vaccinator for the H1N1 virus, because then the vaccine will be provided to that provider so they can then give the vaccine to their family. So if they have that level of comfort, please share that information with them.
Dr. Drake, I mean, typically that information would get out to the physicians and they would, or not.
It's not typical, but it is going to occur this year. It's an unusual thing. The State Health Department, in collaboration with the Connecticut Medical Society, is soliciting all of the physicians in the state to encourage particularly primary care physicians to provide immunizations with the new novel flu. And then if they apply, they will become recognized providers and receive the vaccine directly from the state.
And would that be for no cost as well?
There's no cost for the vaccine. There will be a certain fee for the administration and handling of the vaccine, and that figure will be
On a
determined.
sliding scale kind of thing?
I can't, it's
Yeah.
done on a private basis.
Private basis, yes.
Compensated by the insurance companies and so
And what
on.
about the clinic that day, there's no fee at all, correct?
For the seasonal flu, there will be, insurances will be billed, just like we do every year. But there is some money available through grants for some families without any insurance.
Is that the same for the health-based clinic as well?
The school-based health centers, we will, if we have the opportunity to bill the Husky insurance, Medicaid, but there will be provisions made for those who are uninsured
Indigent, yeah.
or, underinsured,
Yeah.
to be able to have the vaccination
Yeah, so
without cost.
the important thing is that the federal government and state government is pushing the insurance companies to cover it like the regular flu vaccine each year. And that's an ongoing conversation, but from what I understand, Dr. Draper, you can tell me if this is definite what you've heard, is that looks good, it's going forward, it's an everyday conversation, and there should not be an issue with anybody who shows up at a clinic to get the H1N1 vaccination.
Now, we've been talking about our public school students, and we work, well, certainly the city works with the other population, our private and parochial. We have an obligation by state statute to communicate, and we place nurses in the private schools. Maybe you want to talk about that relationship a little bit and how we might communicate with that category of folks as well.
Well, like you said, we have a direct link with our non-public schools through our school nurses. We provide the school nurses in those schools, so all plans that we have automatically go to the non-public schools as well, and they are treated just like the schools in our public school system. So all the same information is disseminated, the same tracking, all of that.
So other than the school-based clinics, I would think they would have access to the other.
Yes, absolutely. We plan
Correct.
to, yeah, absolutely.
And they clearly will be invited to participate
Yes.
in that clinic
In the
on Saturday, September
26.
26th.
Yeah.
All school children, irrespective of what school they attend.
Yeah, it's important to know for parents to know that Abbott Tech and also WASCON are always in constant contact with us, either it be for the emergency plan or the flu vaccine. So we have our partners. There's just so many, we can't state them all today.
Okay. Did we talk a little about school closures? How do you see that operationalizing?
From my perspective, as a medical advisor, our theme really is sick children should be at home and schools should remain open. So I think our major effort this year is to keep the schools open for well children. So that's what our objective is. So it would require, I think, a rather severe emergence of more severe form of the infection that hasn't occurred so far for those recommendations to change.
Understood. Given where we were
Is that your
last,
thinking?
It's much.
given where we were last spring, the research in Australia and what we know now,
Right.
we're coming at this as typically the flu, diagnosing the correct one and having parents making sure kids have the right rest,
Right.
nutrition, staying home for 24 hours after the symptoms have gone for them to return.
Right.
So,
But I think in fairness, we have to say this is a new virus, and our experience is something that's ongoing.
Mhm.
So that all of the recommendations we make here today are subject to what events may occur that might show any change in the virulence of the infection to change it to more severe. And if that were to occur, then obviously we'd be making different recommendations.
And for the public's edification, there's constant communication going on for updating and sharing. If we come to that watershed position, we'd be able to communicate to make that adjustment with our regular
Absolutely.
organization that we have.
We're in constant, not less than weekly, conferences with the State Health Department on this particular issue, and they are in constant contact with the CDC.
And you're feeling comfortable that there's good communications?
Oh, absolutely, and the research goes beyond Connecticut, Danbury. It's throughout the states and throughout the world, because the World Health Organization monitors what's going on. That's why if there's a change out there, not just in Danbury, United States, but the world, will know about it that hour.
Well, we're going to come an end here. Would anybody like to?
I would just like to
Close.
say that, as with everything with the school district, we really count on parents to be our partners. So I think the communication back and forth with our families are going to be important. So I would just like to say that as we know things, we will be getting frequent letters out to families. If you have specific questions about your child and whether they should come to school and what is going on, they're always free to call the health offices, work closely with your school nurse. We'd like to encourage parents, if they do call in their children, that their children are going to be absent that day, that they give a reason more, so that can help with our tracking, especially if the reason is flu-like symptoms such as a fever over 100, cough, sore throat, so that we can kind of keep on top of that. So again, that communication is vital to the success of any plan that we have put in place.
And do we have anything on our website for parents if they want access?
We have a lot of links on our website. We have all our things from last year as well, that there are the same messages, and as we distribute more letters, they'll be always on the website.
Anyone else like to close? No. Well, I'd like to thank the panel for being here, Dr. Draper, Mr. Leroy, Mrs. Bonjour, and Mrs. Lavasia. I think they've planned well, and I feel confident that we're going to start the school year with the right information. And as always, we have the best interests of our youngsters in mind, and the faculty and co-workers. So I thank them for their hard work, and I hope you found this to be a very informative session. Thank you.